Hello and welcome back. Today we're going to be talking about what really is public health. There's a lot of misunderstanding what it is versus what it's not. Everyone's asking, what is public health? And how is it different from population health? And how really is this benefiting me? Well, let's go straight to an authoritative definition. The CDC Foundation, which is the non-profit arm of CDC, declares it this way: the science of protecting and improving the health of people and their communities. Not individuals, people and their communities. The groups, the entities. It is a field with deep roots. And the first time it was introduced into the written language was by this man, Fiennes Morrison. He was a traveler and he was a secretary for the highest level up in the government in the UK. And he wrote about this in one of his travel journeys. First appears in 1617, and he found it in use, public health, in Italy, where they were implementing it both from a perspective of quarantine, but also from the perspective of travel certificates for safety reasons. Now, if we look at the journey of how often public health has been used in written language, we see a rise up through the 1920s, a bit of a dip in the 60s and 70s, and then gaining momentum thereafter. The greatest public health achievement, most people agree to this, is vaccination. Now, by all means, public health and the workforce does not take full authority and responsibility or even credit for vaccination by itself. It was a team sport, and public health is a team sport. But vaccination is an ideal example of how public health works. It is an intervention that is protecting upfront, saving lives by implementing a widespread impact. So think about how widespread smallpox became eradicated as a result of vaccination. Polio nearly eliminated. In the 50s and 60s and 70s, people got polio. Measles, diphtheria, rubella, all been controlled thanks to vaccination. What exactly does public health do? If we dive a little bit deeper, you'll hear terms like primary prevention. And what do we mean by that term? That term is, for example, injury prevention, like seatbelts and helmets and these kind of things. Why? Because by implementing these type of safe equipment, safe ways of operating, we're able to prevent the disease from happening, the injury from happening in the first place. So seatbelts is a great example of primary prevention. Another example is secondary prevention. What does this mean? This is when disease already has taken place, but we are proactive in surveilling the population so that disease does not progress. So for example, in the oral health space, implementing screening and 2 times a year being able to go to get your teeth cleaned is an excellent secondary prevention and public health strategy. That is the government's way to ensure that we have good teeth and that it doesn't escalate into root fillings and even worse. Then comes tertiary prevention. Tertiary prevention in primary care, tertiary prevention in public health is chronic disease management and prevention. So for example, aquatic therapy that I have worked in, it is an excellent example of tertiary prevention. Here, people with disabilities can go into the pool and be suspended and exercise and swim and dance in a way they cannot do on land. So it's very freeing. It helps with cardiovascular exercise. And so anywhere in a local community where they have an aquatic facility, and specifically warm water therapy, is a form of tertiary prevention. Now, how does actually public health work? It works this way: 3 different mechanisms for getting the work done. One is through education, where we're trying to elicit behavioral change. So we do things like mass campaigns, and you can think about tobacco campaigns. That is a great example of an educational mechanism. Whereas engineering is when we change the environment. For example, in Cleveland, they have done a lot to build out safe food hubs where people can come and eat healthier food in food deserts. That is a great example of engineering, changing the environment to lean towards healthier environments. Fluoridated water is another example, sidewalks, and so forth. And last, enforcement. What do I mean? This is when public health is actually changing policy, moving up to regulate the environment. So for example, mandating seatbelt was very controversial back in the day. Now it seems like, well, versus tobacco control, that tobacco is not allowed to be, smoking inside and things like that in public facilities. Or think about it from the perspective of pools. A lot of people go to pools and they don't maybe understand that there's actually a sanitarian on the back end of that who comes around, an engineer, to inspect those pools, that they're meeting the standards so it's safe for you to swim. The field is enormous. As far as training ground, in the US alone, there's 271 programs, 68 schools of public health, 173 public health programs, and 30 standalone bachelor's program alone. I'm proud to say that my own program, where I graduated from my MPH, San Jose State University, is one of those 30 standalone bachelor programs. But maybe more impressive, public health is everywhere, and it is buried into governments, but it is visible in that these people are on the front lines in the local public health departments. There's almost 3,000 local public health departments throughout the US, DC, and US territories. And they are doing the heavy work of inspecting restaurants, inspecting pools, doing vaccination, and so forth. Lastly, I want to pitch a book about public health. It is beautiful. Now, it is a children's book, but it is just as compelling for me and you, and that is, it goes through the whole alphabet to explain all the ways that public health influences our lives for the better. So public health is all of us. I hope that you will drop something into chat of how public health has helped you.